Hi, Elaine.
Hi, Ellie.
So I have a list of questions for you today, and they are our top asked questions from some of our customers. And I know that you will have all the answers. Are you ready to jump in?
Sure.
Okay, so let's get started. How do you know what your skin type is?
Okay, I love this question. I think this is a really important question for everyone to ask before they purchase and choose their skincare products. So basically, there are 5 main types of skin types. You have people with oily skin, so that's when your skin is producing excessive oil, there's sebum that clogs your pores. You can have oily skin without acne, but quite often it does lead to pimples and breakouts. Then you have people with dry skin, so that's when your skin isn't producing enough oil. So when you wash your face and if you're not applying anything straight after, it tends to feel really tight and uncomfortable. It can get flaky and just difficult to apply any type of foundation and makeup because it then gets cakey. And you have people with combination skin, which is a little bit of both those types. So combination skin is usually where you get oiliness around your T-zone and then dryness on the other parts of the skin. So the parts where it's oily, it can look really shiny, it can look really congested, big and large pores, and then the other areas of dryness often then looks like it's flaky or it can appear red as well. And then if you're really lucky, some people have balanced skin.
So some people would call that like a normal skin type, right?
Normal skin type, balanced skin, that's where your skin is neither too oily nor dry. It feels moist, it feels healthy, it's got a nice glow, it's bouncy. Some people are born with it. Some people do really take good care of their skin so that they have that nice, normal, moist, balanced skin. And then the 5th category is what I call sensitive skin. Some people are born with sensitive skin, which means they need a lot more care when it comes to selecting products. And if they use a product that their skin does not agree to, they can get a reaction or just feels uncomfortable, they can break out. But we don't want to mix up sensitive skin with sensitized skin. So sensitized skin is when you're born with normal skin type and then you don't take care of it or you expose it to chemicals that it doesn't like. So then the skin barrier is compromised, it's damaged, the natural oils are stripped away. So then the skin becomes reactive to a lot of different things. So sensitive skin and sensitized skin.
And how would someone describe their skin? I know we have a skin quiz that people can go into and have a look, but what are those keywords that you'd be looking for when you're trying to figure out what your skin type is?
Yeah, so oily skin would be things like congestion, you get breakouts often, there's a shine without you applying anything over it. Dryness would be flakiness, roughness, little bumps can form when it's really dry, and then dryness can sometimes lead to rosacea as well. It just basically means the skin's like thin and it's easy to react to things. So dry skin and sensitive skin, they sometimes go hand in hand. Balanced combination skin is just kind of like your happy-go-lucky type of skin types.
And can your skin type change over time or as you age? What's the thing to look out for with that, with skin types changing?
Yep, absolutely. So as most teenagers would go through hormonal changes, so that's when your skin is producing a lot of oil. That's why with teens, it's important that we teach them early on good skincare routine. So cleanser and a simple moisturizer and sunscreen is important. So young people, young adults tend to have oily skin. As we grow older, the skin doesn't produce as much oil. So then people move towards the dry skin type or combination skin. There can be hormonal changes as we reach adulthood. So then you do have a small percentage of people who may experience adult acne. So that's like your cystic hormonal acne. They can be tricky to manage, but can still be managed with good diet, rest, good skincare routine. So we can talk about that in another question. It's a big topic.
Fantastic. Okay, that's a great place to start. Thank you.